Topiramate can be given to you to treat many of the conditions, including epilepsy. However, when you take this medication, you should know important facts. What is its effect on the kidneys? Whether it should be taken with alcohol or not, and how it can affect the acid levels in the body. What is its effect on vision? All such things are very essential to know while using Topiramate. In this video, we'll cover such important facts about this medication. Clinical uses. Topiramate can be given to you for the treatment of seizures. It can be given to both children as well as adults. In the children with an age of about 2 years, it can be given. It is also used to control a severe type of seizure called Lennox-Gastaut syndrome. These seizures can appear in childhood, and they can continue as you grow. They involve seizures, behavioral problems, cognitive dysfunction, and some delay in the developmental process. To control such types of seizures, Topiramate can be given. This medication can also be used to control the migraine headaches in the adults. Apart from these clinical uses, it can also be used to control the symptoms of chronic alcoholism. How it works. Topiramate reduces the activity of a few neurons in your brain. Particularly, the sodium channels are responsible for increased neuronal conductivity. This medication can reduce the activity of voltage-dependent sodium channels. This reduces neuronal transmission and thereby reduces the seizure frequency. Topiramate can also increase the activity of another inhibitory neurotransmitter called gamma-aminobutyric acid. By activating this mediator activity, it can increase the central inhibition and reduce neuronal conduction. How to take this medication? You can get Topiramate as tablets as well as extended-release capsules. It is available in different strengths from 25 milligrams to 200 milligrams. However, when you're going to take the extended-release capsules, they should be taken only once daily. You can take the Topiramate at any time before, during, or after a meal, but remember that you have to drink plenty of fluids during the day to prevent any development of kidney stones. For the treatment of partial onset seizures or generalized tonic-clonic seizures, you may be given Topiramate at an initial dose of 25 milligrams given twice daily. The dose may be slowly increased at weekly intervals to a target dose of 200 to 400 milligrams per day. This medication can also be used to treat the migraine headaches, where it can be started at an initial dose of 25 milligrams. The dose can be slowly increased on a weekly basis to a target dose of 100 milligrams per day, given in divided doses. It can also be used to treat alcoholism, where it is started at 25 milligrams per day. Kidney stones. Topiramate can increase the risk of kidney stones. Therefore, you need to take a larger amount of fluids to increase the urinary output and reduce the concentration of substances that are involved in the stone formation. Hydration is also recommended to reduce new stone formation. When the calcium levels in the urine is increased, it increases the risk of kidney stones. Topiramate can increase the urinary excretion of calcium, as well as decrease the citrate excretion. When the ratio of urinary calcium to the urinary citrate is increased, it promotes the formation of kidney stones. This effect is particularly observed with immediate-release tablets of Topiramate. It can be more pronounced in the children. Therefore, when you take the Topiramate, try to take more fluids in order to reduce the risk of kidney stones. Body temperature. Topiramate can reduce sweating, which reduces the heat dissipation. Therefore, you may have increased body temperature. This condition is called oligohydrosis. It is a condition of decreased production and secretion of sweat, which raises your body temperature. This effect can be observed when you combine the Topiramate with carbonic anhydrase inhibitors, like acetazolamide. This may result in a few symptoms like flushing, redness of the skin, itching, irritability, and heat sensation. This effect is more pronounced in the children compared with adults. This effect can also be observed with the use of anticholinergic agents along with Topiramate. Ammonia in blood. When you use Topiramate with another anti-epileptic agent like valproic acid, you may observe increased levels of ammonia in your blood. Normally, the ammonia is going to be produced as a waste product after the metabolism of proteins. It is going to be converted into urea within the liver. This urea is then excreted in the kidneys. When this process of making urea or its excretion is impaired, you may observe accumulated levels of ammonia in your blood. This condition is called hyperammonemia. With high levels of ammonia in your blood, you may have few symptoms like reduced alertness, vomiting, and feeling tired. Topiramate, when it is combined with valproic acid, can increase the levels of ammonia in the blood, leading to these symptoms. Effect on vision. With the use of topiramate, you may have pain in your eye. Redness and a decrease in the visual acuity may also be observed. This may indicate the development of secondary angle closure glaucoma with the use of this medication. The intraocular pressure may also be increased in your eye, resulting in the eye pain. Your pupils may be dilated, and you may have difficulty in seeing nearer objects. You may get these symptoms within 1 month of treatment with topiramate. These effects can be observed both in the children as well as in the adults. Therefore, check for your visual acuity if you observe any change in your eye. In case of any development of angle closure glaucoma, you have to discontinue this medication. Effect on bones. Topiramate can reduce the bone mineral density. This medication can increase the calcium excretion in the urine. It also decreases the parathyroid hormone and vitamin D levels, which may reduce the bone density and increase the risk of fractures. Again, this effect is more pronounced in the children with an age group of 6 to 9 years. Metabolic acidosis. Topiramate can cause another condition called metabolic acidosis. It is a condition of increased levels of acids in your blood. It is due to an imbalance between the acids and bases in your body fluids. When the acid levels are more accumulated, it results in the metabolic acidosis. This may be due to the increased production of acids in the body or due to loss of bicarbonate from your body. Topiramate has a weak inhibitory activity on an enzyme called carbonic anhydrase in the kidneys. This enzyme is responsible for the breakdown of carbonic acid into water and carbon dioxide. It is also responsible for the absorption of bicarbonate along with sodium. Topiramate inhibits this enzyme, which results in the more excretion of bicarbonate. As bicarbonate is lost from the body, it may increase the acid levels, leading to metabolic acidosis. With the development of metabolic acidosis, you can see a few symptoms like increased ventilation and hyperventilation, tiredness, loss of appetite, irregular heartbeats, and impaired consciousness. This may also increase the risk of bone fractures. This metabolic acidosis is more pronounced if you have any renal disease, respiratory disorders, or severe diarrhea. Effect of alcohol. When you take topiramate along with alcohol, this may increase the sleepiness and dizziness. You shouldn't take the topiramate extended-release capsules within 6 hours of alcohol intake, as it may impair your attention and may produce lightheadedness. Never stop this medication suddenly, as it may increase the risk of seizures or seizure frequency. Side effects. You may have a tingling sensation in the arms and legs. You may feel less hungry and have nausea and diarrhea. You may also observe a change in your food's taste. This may result in weight loss after a few months. You may also have nervousness and upper respiratory tract infections. Topiramate can also produce some suicidal thoughts. Other side effects like dizziness, weakness, loss of balance, abnormal vision, confusion, and decreased memory can be observed. That's all about different facts of topiramate that you should know while using this medication. Drinking plenty of fluids is highly essential every time you take these tablets or capsules. A better idea and knowledge of the possible side effects will make you use this medication safely and wisely. That's all about this week's story. Thanks for watching this video. If you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.